Erica. Oh, we gotta turn on the mic. The mic that has no batteries. Oh, there we go.
No, it's not bad.
Okay. Yeah, you're up and running. Hi, everybody. Welcome to Fertility Fact or Fiction. We are in our kitchen this time because we have the amazing Dr. Jennifer Strong, naturopathic doctor, with us after way too long an absence and delay. So thank you for coming back.
8 months.
It has been. We're staying relatively COVID distanced here, so that's all good. And tonight we got a fascinating topic because we are going to review prenatal vitamins, which is entirely Dr. Strong's area of expertise. And so she's going to offer us all of her insights and information. We're actually comparing several different brands. So I know they're a bit far. We'll bring them up close. This is the NFH product, Prenatal SAP, for those of you that want to see that. We've got Progestia from YAD, which is also a great product. We have the infamous Pregvit Folic 5, which comes with the white and the pink, or sorry, the blue and the pink pill. You can see them there on the front, they're up and down. And then we've got the Kirkland brand for all those of you that love to shop at Costco, because why wouldn't you need 5,000 of one item? And then we've got Materna, which is kind of tried and true and has been around forever. I think the only one we're missing is Centrum Prenatal, which is identical to Materna. It's actually identical because Centrum actually bought Materna, and then Materna restarted Materna. So they're identical in every way. There's no difference between the two whatsoever. So we always give everybody a few minutes to log on, and hopefully you guys have all been staying safe. Unfortunately, the pandemic is kind of coming back slowly in greater numbers than we would have liked. So we are hoping that everyone is doing their best to stay safe and healthy, and we will hopefully all get through this. And now with the vaccines coming out, for those of you that haven't already heard, Moderna had a 94-point-something% vaccination success rate in terms of developing immunity. And the one from Pfizer apparently is just over 90% as well. So they are anticipating that this will be finally over sometime around April or May is the expectation. And the stock market reacted by going through the roof today. So hopefully we're getting through this, but we do need to now vaccinate everybody. So there's some steps to take, but we're getting there. So with no further ado, I'm gonna turn the stage over to my amazing colleague, Dr. Strong. Jen works with us here and sees all of our patients and helps our patients out when they're struggling. She's got an amazing background in naturopathic medicine and likes to subspecialize in fertility as much as possible. So she's going to chat about all these vitamins and what's good and bad about each one. So I'll let you take it away.
Great, thank you. So guys, I thought this would be really cool if we could make it interactive. So if you wanted to go grab your prenatals at home, I'm sure most have a prenatal at home right now. So go grab that and we'll take a look at your label as we're going through these ones as well. And then you can ask some questions that way. So I thought this would be a good topic because usually when patients come in to see me, they're already taking a prenatal. And one of the main questions is always, is my prenatal okay? So I don't really have an absolute favorite of prenatals. It usually depends on what's going on with each person. I do have one that I often use, and you'll be able to figure that out in a little bit. But a lot of the ingredients in there, we usually look at what's going on and what you need lots of, and then look at which prenatal has what you need the most. Okay, so we're just gonna go through the ingredient list. So we'll start off at the top. So most of them start with vitamin A or beta carotene. So with most of these, they're all very similar. Your Kirkland and Materna and Pregvit have similar amounts. Your prenatal SAP actually doesn't have any, so that one's a really good choice for those who are smoking or just have an adequate amount in their diets. And then the Progestia is quite high in vitamin A. Am I looking at the camera?
Look at the camera.
Okay,
Yeah.
sorry.
Yeah.
So the Progestia has quite a bit of vitamin A in it. So if there's absolutely none in your diet, then that one's a good one to go with. Vitamin A is found in foods. Pretty much any food that is orange has a lot of vitamin A in it. So your pumpkins, sweet potato, carrots, orange melon or cantaloupe. My kids call it orange melon. But otherwise, it's not a huge concern with pregnancy. There's not a huge amount of benefit in taking a lot of it, and it's actually not a good idea to take a lot of it because it can cause some harm.
Yeah, so if you have over 10,000 units per day of vitamin A, it can be harmful to the fetus in terms of causing teratogenesis, which is when the fetus can become it can become morphologically abnormal, meaning you can actually cause abnormalities in what the baby looks like, and they can be quite drastic. So you want to stay under 10,000. All of these obviously do stay under 10,000, but the progestia has a relatively high level. We said 5,000 in that one. I will throw in there, just from the obstetrical standpoint, that the fact that this doesn't have vitamin A is excellent if you're a smoker, but by no means does that mean that you can go ahead and smoke and then use this. We want you to not smoke because literally every single risk of pregnancy is increased when you're a smoker. So avoid smoking like the plague, please.
All right, so moving on to the next one. Vitamin C is usually the next on the list. So with vitamin C, especially right now, there's always the need for vitamin C during cold and flu season, and obviously during the pandemic. High amounts are great. You won't find a high amount of vitamin C in your prenatal because the need doesn't go up that much during pregnancy, although it's still really important. So there isn't a whole lot of difference between the prenatals, although I will say progestia doesn't have any, but the rest of them have a good amount. So ideally, you'll want to, if there's a concern, you'll want to supplement more with vitamin C. Foods that have a lot of vitamin C, obviously your fruits are really high in them. And then a lot of foods are fortified with it, like your Vector cereal and others.
Orange juice and so on.
Yeah.
So what would you normally recommend to someone who wants to just stay healthy? How much would you recommend?
How much vitamin C?
Yeah.
Yeah, so 2,000. So in divided doses, you could do like 500 4 times a day during cold and flu season, and it won't usually cause a problem.
Okay.
Bowel tolerance is usually how you know you get enough vitamin C, but no one really wants to go to that. So usually about 1,000 to 2,000 on top of like your dietary amount is a good amount to help with cold and flu prevention.
So these really aren't even close, are they?
No.
This one's got 58. This one's got 120. The pregnant.
Yeah. So your RDA is only 60. So
Oh, really?
you won't find much in
any of these.
a prenatal or a multivitamin.
So RDA, for those of you that don't know it, is your recommended daily allowance. So that's what they recommend that we use. So these are, I guess, close to the RDA, but nowhere close to what you would recommend. So should patients supplement on top of this? Would you recommend, or is this good enough, you think?
So, like for fertility purposes?
Yeah,
So
or
increasing
pregnancy.
vitamin C helps regulate progesterone levels a little bit. I think it helps with, although men wouldn't take a prenatal, but helps with sperm
Okay,
production.
yeah. Anything antioxidant is good for sperm.
Yeah.
So yeah. Yep.
Yeah, so I guess it just depends what for, but there's usually always a reason to take vitamin C.
Okay, perfect.
So vitamin D is next. With vitamin D, 400 is the recommended amount. Over 1,000, interestingly, is considered a drug, so you won't find more than 1,000 in any supplements. But vitamin D is really good for improving fertility and in cold and flu prevention. So right now, it's a good time to take that. In terms of these, so they're all pretty similar with vitamin D. If you take the recommended amount, they're around 1,000. Your private, your Kirkland one's a little bit less.
How much is in private?
Private is 600, and Kirkland prenatal is 400.
Okay.
Materna is 600, and progestin is 1,000.
And this fancy NFH
That
stuff?
one, so the other thing to mention is this one is 3 a day, 1 a day, 2 a day, 1 a day, 1 a day. So if you take the recommended amount, that's 1,000 a day.
This one is?
Yeah.
Okay,
At
yeah, it
3 a
says
day.
333 international units. Yeah. So, okay, so they're roughly close to each other,
Similar,
except for the Materna and the Kirkland brand. Okay, yeah.
And then, so vitamin E is next on your label. So vitamin E typically it's about the same in all of them, except Materna is really low. It's only at 7, the rest are between 30 and 50. With vitamin E, in terms of fertility, it's helpful for improving the endometrial lining. It's another antioxidant, so there's always a need for antioxidants.
Yep.
In
men and women, so we use them for both. Yep.
Yeah, and then with pregnancy, the need for vitamin E doesn't go up. Dietary-wise, you get vitamin E from your nuts and seeds, whole grains.
Good.
Vitamin K is next. So vitamin K is only found in the prenatal. So the interesting thing about
You mean this one?
yeah, sorry,
Okay,
NFH
yeah,
prenatal.
yeah.
Yeah, so there isn't any vitamin K found in the other ones. Vitamin K does thicken the blood a little bit, so oftentimes it's not recommended for those going through fertility purposes because of all the blood thinners they're on. But with the vitamin K that's in the prenatal SAP, it's plant-based, so absorption rates are really low, and the amounts are really small.
Okay.
So no need for vitamin K in your prenatal. And then we get into the Bs. So B vitamins, they're going to be quite low in a lot of these, like around anywhere from 1 to 3 milligrams. The NFH one, it's quite a bit higher. The purpose of vitamin B, all of them really, they're used as cofactors in a lot of different pathways in the body. So if levels get low, it's kind of like the Chrysler production line. If one person's missing, then the pathways don't work properly. Each one has like a little bit of a different benefit. In terms of pregnancy, folic acid, so that's a B vitamin, that one, the need is higher, but the rest of them, the need isn't much higher. So folic acid. Folic acid, so there's 2 forms of folic acid. The regular type of folic acid is found in these 3, and then your NFH prenatal.
This is folic acid also. Yeah, so these 4 have just folic acid, and then this one?
Yeah, so that one has the methylfolate form. So methylfolate is helpful for those who have the genetic defect, meaning they don't metabolize folic acid very well. So methylfolate is metabolized a little bit differently, so you absorb a lot more of it. It's a little tricky to test for, so I often just recommend for those who have been trying for a long time or have an undiagnosed reason for infertility to just switch to the methylfolate form, so that way it rules out that problem. Otherwise, yeah, these ones all just have the regular folic acid form.
So that's the MTHFR gene mutation that some of you may have heard about, or methyl tetrahydrofolate reductase enzyme deficiency. So this is what you use if that exists for you, and we can test for it, although it is difficult and you have to pay for the test. These ones would not help you if you've got that issue, so there is that element to it.
Yeah, and with folic acid, the need is more to prevent deficiency that could cause neural tube defects. So I believe 400 is like the recommended.
Minimum 400, 4 milligrams if you've had an actual problem in the past, like a baby with a neural tube defect, so spinal cord problem, any kind of brain development problem, anencephaly, those kinds of things.
Okay. And then B12, so cyanocobalamin or B12 levels are needed about in the same amount during pregnancy as not being pregnant. just like folic acid, there's the two different forms. So if there's a concern with metabolizing it, then the methyl form is better than the cyano form. And then we get into the minerals. So the main nutrients that are more needed in higher amounts during pregnancy would be your calcium and your folate. So calcium needs increase a little bit. They're all pretty much similar between these five, but the form is different. So progestia, I don't believe has any, so no calcium here.
No calcium?
Nope, no calcium there. These ones have calcium, it's calcium carbonate. So I usually tell my patients if there's no concerns with metabolism, like no Crohn's colitis, diverticulitis, IBS, any digestive issues, then don't stress about it. Any type of calcium would be fine. If you struggle with digestion in some way, then use a form that's a little easier to digest. So prenatal SAP has the calcium citrate, which is a little easier to digest. The amount's lower, but you absorb more of it. And then iron. So similar situation with iron. So if you have a hard time absorbing iron, then you can switch to an easier form. So Materna, let's see. Materna, Kirkland, and Pregfit have the fumarate form, and that's often why a lot of women get constipated with taking prenatal vitamins. It's just it doesn't absorb well, so it sits in your gut and causes constipation. And progestia has the fumarate form too. Prenatal NFH has the glycinate form, so it allows for easier digestion, so it doesn't sit so much in the gut. You absorb more of it, and constipation usually isn't an issue.
And there is recent data that your iron level going into conception is important for your success. So it is important to make sure that you have an adequate iron level before you get pregnant. It's also very important during pregnancy because your baby starts to suck a lot of iron out of you in the attempt to build its own blood volume. So frequently, I'd say a fairly high percentage now of women, excuse me, by the time they get to 28 weeks actually have iron deficiency, and we do need to supplement them with additional iron, even when they're faithful to their iron-based prenatal vitamins. So there is frequently supplementation that needs to occur on top of what you're already taking. And for those, we always use the glycosylated forms like what's in prenatal SAP because they're so much easier to tolerate. And at that point, we're giving them quite a bit. It's 150 milligrams in the elemental pills.
Is that the Ferromax?
Ferromax, Halofer, Triferix, and Eurofer. They're the four that can be used. I like Ferromax, but they're all the same basically.
Okay, so iodine's next on the list. You may or may not find iodine in your prenatal. Some have it, some don't. These ones all do, and they're all in about similar amounts. Progestia does have quite a bit more. Progestia's got about 1,000. The rest are between 150 and about 220. So iodine's nice for those with if thyroid concerns are a problem, but the tricky thing is with iodine is if a deficiency of iodine can cause hypo or hyperthyroidism. So it's a little tricky knowing who benefits and who doesn't from that one. Okay, so we get into magnesium. So with magnesium, they're all pretty similar. Progestia doesn't have any, but the rest of them have all similar amounts of magnesium. Magnesium is nice because it's a muscle relaxant. So with pregnancy for leg cramps, if there is a deficiency in magnesium, replacing the deficiency helps with the leg cramps. Helps with some bowel function as well. And then zinc. So zinc is similar across the board. Materna's only got 2.4, and the rest are more in the 15 to 25. So if your need for zinc is higher, just check what your prenatal has. If it's not enough, it's really easy to add that in on the side. You can buy zinc on its own at about like 15 milligrams.
Maybe just the highlights of the other ones. What else is really drastically different between them?
Yeah, that's actually pretty much it. The rest are all very similar. Like your prenatal SAP is going to have a little bit of everything, whereas these ones, that's it. That's pretty much all it is.
So this is a bit more of a complete vitamin for nutrients and the basics than the other ones are.
Yeah.
So can you tell us a little bit about the cost differences between these?
So
in Canadian dollars?
I don't know, does it change with pharmacy? I just know like the prices at.
It might change a little, but they're probably reflective of most places.
So prenatal SAP, so that one per day. So if you were to do 3 a day, it's 85 cents a day. Private, so is that one covered?
Private's often covered,
Okay.
so you need a prescription for this because of the amount of folic acid it contains, but because you're giving a prescription, it is frequently covered.
Okay, yeah, because if it's not covered, it's $1.33 a day. If it's covered, it's covered.
So this is about $1 a day, or sorry, almost
85
$1, 85 cents,
And
$1.33.
Yeah, and the rest, like Kirkland is 6 cents a day. So
6 cents a
you
day?
can't compete with that. It's
Wow.
one a day. Yeah. Materna is 22 cents and Progestia is 41.
So in order of pricing, it's like that.
Yes.
Okay, so your Pregvit is your most expensive. Your NFH prenatal SAP is next. Progestia third, Materna, and then you can't really compete with something that's 6 cents a day.
Yeah.
So your cost can be a factor.
So I usually say if someone comes in with this and they're in stellar health and they have no health concerns that they want to work on, and they really just need the folic acid, then it's fine,
Sure.
right?
And what do you recommend to the moms that can't tolerate any of these? They take it and they are too queasy.
Okay, so the one we're missing today is the Smarty Pants. So there's a gummy. So the label says you have to take 6 a day, but the gummy at 6 a day has the right amount of folic acid in it and then a few other nutrients. So that's an option. And then we usually try to figure out why though. So, you can take it before bed maybe and sleep it off, or take it with food, or sometimes the smell. Like I know sometimes women don't like this one. It's got a lot of B vitamins in it, so it has like a bit of a smell to it. Yeah, so I usually just say keep it in the fridge and that'll keep the smell down. Yeah, the gummies, I guess.
And I actually tell them to take Flintstones because no one ever wants a Flintstones vitamin. So 2 or 3 Flintstones is equivalent to taking some of these. So I just tell them to take the Flintstones.
Is it? Yeah.
So Flintstones work as well. Plus they're cute. So
the iron one though, right? Sorry.
The iron one, yeah. Mm-hmm. So you get to decide if you're having Fred or Barney or Walmart or Bam Bam or whatever. And that works really well. So your go-to vitamin for our fertility population is this one.
Yeah, so for those that we usually see here, they've been trying for a while, then
use the best.
That one.
So that's the NFH product, the prenatal SAP. I think I tend to kind of automatically go with Pregvit, but maybe after this we'll start using more of this NFH product. And we'll have to see if NFH can do something to bring the price a little bit lower, because although this is more expensive, our patients are getting it covered. Mm-hmm. So maybe we can chat with them and talk to them about the fact that we'll support them, but they have to drop their price for our patients. So we'll reach out to them and see if that's possible.
And the other nice thing, just one last thing, with this one, it's nice because they separate the calcium and the iron, whereas none of the other ones do.
None of the other ones do, yeah. Awesome. Well, thank you, Jen. Appreciate you hanging out tonight with us and bringing us all the info on this. So we're going to go to the question part. Tarek is going to read the questions off the phone sideways because I can't read them from my computer on the other one. So the Instagram I can't see here. But I did have some questions from people that were asking earlier, so maybe I can bring up those for now, and we can go over those ones. Is that okay?
Yeah.
So one is thoughts on tamoxifen instead of letrozole for FET prep. I have been prescribed tamoxifen for a thin lining. I hear you comment on the benefits of letrozole, just wondering how tamoxifen compares. So I've only actually used tamoxifen once, and that's recently to see if it would help because we had tried everything else and we could not get this young lady's lining to thicken. It didn't seem to make much of a difference. Tamoxifen is a drug that's used for breast cancer, much like letrozole, but letrozole is fairly neutral in the uterus, whereas tamoxifen actually can cause endometrial cancer in the uterus because it really can thicken your lining. So some people have used it to try and benefit in that regard. It's hard to do so if you are going to keep going with it. It might make sense, but probably not for just 5 or 10 days worth. So it's probably a drug you would need to use kind of long-term to try and thicken that lining. It does have risks of blood clots used long-term, and you can't go on forever because that can cause a problem. So hopefully that answers that question. Let's take some questions from Facebook. Valerie. 28.7 was my last vitamin D lab work reading. I've been taking 10,000 units of vitamin D3 daily for a long time now. Wow, 10,000 units. Along with my prenatal, I am currently 29 weeks, 3 days pregnant. Is there a reason why my vitamin D level is barely staying in the acceptable range? Jen?
So vitamin D is a fat-soluble vitamin, so it's recommended to take it with foods that have fats in them. So taking it with like nut butter, like toasted nut butter or avocados might help with absorption. But that's a lot to take for a long period of time.
The 10,000. I've never heard of anyone taking that much. Although we do use the 50,000 once a week.
Oh, oral, yeah.
Yeah, there's an oral, and you can also do an injection.
Mm-hmm.
So Val, if your level is that low, I'd probably say switch to the injectable version to see if your absorption is better. Some people do have a very difficult time absorbing vitamin D. The alternative would be to try taking it with something that has healthy fats in it, like nuts or avocado. I think bananas have some natural fats in them as well. So there's some various foods you can get that have that. What's next? What would you recommend for women who are diagnosed with ITP, that's idiopathic thrombocytopenic purpura, on how to maintain a healthy pregnancy and to ensure baby is safe and not pass terrible platelets? Do you want to tackle that one? I was going to turp that one to you. Okay, so ITP does not normally impact baby that much unless your platelets drop so low that you can't clot. The only time baby gets affected is if you have antibodies to your platelets. Having said that, it can become a problem at delivery where you may be excluded from getting an epidural or a spinal. They may need to put you to sleep. You may experience more bleeding. So I don't know about a naturopathic approach to it. I know from the medical approach on our side, traditional Western medicine, we tend to use steroids in most circumstances to stabilize your platelets when you have ITP. And then in really severe cases, we use something called IVIG, which is intravenous immune globulin, and that can help bring your levels up. We don't tend to do it till you get kind of close to delivery where it's more of an issue. Unless you're bruising or bleeding earlier in the pregnancy. But again, it's generally not a problem. What do you guys approach this at all in naturopathic medicine?
I haven't, to be honest, I haven't had a patient with ITP, so I wouldn't even know.
Not your,
I'd have to look that one up.
Okay, no problem. That's a you question. Does the prenatal need to be taken at the same time every day?
Ideally, it doesn't have to. Ideally, it would. So, although with this one, 3 a day, so you do morning, noon, and night. Private, there's 2 in there that they have to be ideally separated. You want the iron away from the calcium, so one's morning, one's night. The rest of them are 1 a day. I don't think it's a really big deal to take it at exactly the same time every day. I think it's best to help you remember to take it, to do it every time or same time every day, but like absorption wise, no.
Do you want to see if there's questions on IG that you want to ask us, Tara?
All right, just answer this one and then I'll flip over.
Is it okay to take a multivitamin while taking CoQ10 and myo-inositol?
Yeah, absolutely.
Yeah, for sure.
All right, sideways reading.
We've got, you guys can't see Tara because he's off screen, but he's literally tilted this way so that he can read our questions off of his phone on Instagram. Yeah.
First question, can you ever take 2 prenatals?
So I recommend 2 when you have twins because you do need more.
Yeah.
Twins has a much higher requirement. So keep in mind, guys, that babies are very effective parasites and they are sucking everything out of you. So you do need a lot more vitamins when you have 2 babies there. They're very cute parasites, but they are parasites. I don't know, do you ever recommend
2?
2, or is there too much at some point?
Like 2 different ones, I think. Is the question or?
Yeah, so normally
It could be good.
patients are taking Pregvit. I'll just
Yeah.
recommend they take a Materna because it doesn't have that much of everything. For twins, I guess you'd have to be careful taking 2 Progestia because of the vitamin A
Yeah.
content, because this has 5,000 units and your max is 10. So you got to be cautious with that one, but the rest of them are pretty
Otherwise,
safe.
there's no risk. Yeah, plus the iodine is like
It's pretty high.
too. But
So maybe don't
otherwise,
try
no
2 of these, but the rest of them would probably be fine
Yeah.
to take 2. You wouldn't double your Pregvit though. That would be a huge dose of folic acid. You don't need that much, and there are studies that show that your autism risk increases hugely. It's a 17-fold risk if you have very, very high levels of folic acid. It has to be well above taking 2 of these, but I just wouldn't risk it, and it's not necessary. The only people that need more folic acid than what's in a Pregvit Folic 5 are smokers, and you shouldn't be smoking. So that's, yeah. Next question. Sideways. The camera stuff.
A lot of moving parts here today.
Yeah.
Thank you, Dr. Strong. Always so wonderful to learn from you. How long can one take DHEA for? I have been on DHEA for almost a year. Day 3 follicle count reduced compared to before I started the drug.
Do you want me to answer that one? So DHEA actually has not shown any benefit in improving live birth. So it's kind of fallen off my radar now. I do use it once in a while, but testosterone priming can be done for a very short period of time. You start it normally on day 21 of your prior cycle, and then you can end it when you're starting your stim, or even into your stim a little bit before you trigger for egg release or egg retrieval. So DHEA really is not that helpful. You should definitely not be on it for a year. Usually 3 months is sufficient, 6 months max. You're not supposed to be on it for a year, and it's not going to actually make a difference to live birth. Adding 1 or 2 extra eggs is not helpful if it doesn't translate into an improvement in live birth. Not a single study on DHEA has demonstrated an improvement in live birth, so that's too long. Don't be on it for a year.
What is the ideal vitamin D level for fertility?
So vitamin D blood level for fertility. So the recommended is between 75 and 150. Ideally, 100 would be good.
Yeah, and we try and aim for roughly in that range too. I think the upper limit is 250, if I'm not mistaken.
Oh, yes.
Yeah, so it's 75 to 250, and we usually want you, kind of in that middle range somewhere, so around 100 and something. Let's take a Facebook question. Thanks for the recommendation of the NFH prenatal, Jen. I love it. I forgot to ask at our last appointment, can I take it at night with my levothyroxine?
No. So levothyroxine should be taken away from calcium and iron. So you want to take, if you're taking that at night, you can take your prenatal, maybe 1 at breakfast and 2 at lunch.
Perfect. There you go. Why do you recommend birth control prior to an IVF, and why do you get a brown discharge when you're on birth control? So not everybody gets brown discharge, so that one's easy to deal with. We don't recommend it for everybody. But for some patients, it helps line up their eggs, control hormone fluctuations, reduce cysts. So it's definitely not for everyone. If you're older, if your ovaries are weaker, we don't use it. For patients with lots of eggs and strong ovaries, we do. So it depends on the patient. It's not there for everybody, but for a lot of our patients, we do like to use it. You rock, Dr. Victory. Thanks for all you do. Thank you, Cassie. How long can you take melatonin for egg quality prior to an IVF cycle? Do you want to take that one?
Yeah, so I don't think there's a cutoff, just a need for it. So if melatonin helps improve egg quality, so prior to, you can just continue taking it. I don't see any need to cut it off.
Yeah, there's no need to cut off melatonin. Apparently somebody out there is saying that you need to stop it once you're pregnant, but there's no risk to taking melatonin in or out of pregnancy. So as far as I understand it, it's safe. Do you know anything to the contrary?
Yeah, no, you can take it during pregnancy. You usually reassess the need for it. So if you're only taking it for egg quality, obviously you don't need it anymore. And the other thing with melatonin, I usually tell my patients if there's any anxiety type diagnosis, then it might aggravate anxiety, or it's quite commonly causes an increase in night terrors and nightmares. So if that's something that someone suffers from, I usually don't recommend it.
Oh, I didn't know that, which is interesting because we use it to help people sleep. So why does it cause night terrors if it helps you sleep?
It gets you into a deeper sleep. So
where you have some.
So you just don't want to aggravate that.
All right, cool. Deeper sleep, as I kind of call it, OBGYN, is not a good idea because I got to wake up to run babies, so that's not a good job for me. Okay, what is the recommended dose for coenzyme Q10 for PCOS women? So that's a you question, but
you have
yeah.
You said yours.
So coenzyme Q10 comes in different formulations, and traditional CQ10 absorbs very, very poorly. So you actually have to take a huge amount, usually 600 milligrams, to get it to absorb. But then there's ubiquinol and there's ubiquinone. So that's a JS question. Dr. Strong?
So there's been studies with CoQ10 anywhere from 60 milligrams to 600 milligrams that show benefit with improving egg quality. And because it's an antioxidant, it helps improve the endometrial lining too. So you can kind of justify any dose, really. I usually look at how many other antioxidants people are taking, because usually often we have them suggested to take fish oils or vitamin E, and kind of look at the big picture and see how much is needed. And then with CoQ10, there's the ubiquinol.
Right.
The only difference is one electron because it bounces back and forth. So one's better absorbed, and the other one's more active. So I usually don't stress over which one.
Yeah, there's a product from a company called Theralogics. It's called Neo Q10. Which had the equivalent amount in one pill to take in 600 milligrams, which was several pills of any other product. And we used to use that because the absorption was incredible. It's a special formulation and it's patented. The problem was it was so strong, all our patients showed up with rashes. And so we had to stop using it because 28% of the patients came back saying, I cannot take this. So yeah, we stopped. Let's take a IG question. Sideways man.
Is Centrotide start day 8 too late in the IVF round? Started day 7 last round at follicle growth seemed to slow down after starting. RE suggesting starting day 8 this round.
So Centrotide should be started either at a certain estrogen level or follicular size. There was a study not too long ago, several months back, that showed that there was a specific time based on your estrogen level that you should consider triggering. We typically do it when we see that the two largest follicles are around 13 to 14 millimeters. If you wait much past that, you're going to risk the fact that you may get what we call an escape ovulation, where you ovulate even though you didn't want to. So normally when they're between 12 to 14, 13 to 14, we'll start your Centrotide. Each patient's different, of course, and if your Centrotide is slowing down your egg growth that much, you're either not on enough dose of the FSH-LH product, or there's something wrong with the eggs. So it shouldn't slow you down that much. In fact, most studies show that it doesn't slow the egg growth down at all, as long as you maintain the dose. We even slow down our dose sometimes intentionally when we're starting it. So you're not supposed to increase the dose because of starting Cetrotide. You can maintain the same. You should get equivalent growth. I would do more exploration if there was an issue there. You got another one?
Oh yeah.
What today?
Are there benefits to taking DHA before getting pregnant?
DHEA or DHA?
DHA is the
So
question.
those are the omega-3 fatty acids.
Yeah, so DHA is helpful to develop baby's nervous system, so you can take it prior to pregnancy for that. It's anti-inflammatory, so if there's any inflammatory issues going on, it can help with that too.
Yeah, and there are some studies that show benefit pre-pregnancy and in pregnancy. So yeah, I agree, it should be used. They work through something called the PPAR pathway, which is the peroxisome proliferator activated receptor mechanisms. All of those are heavily involved in inflammation in your body, and they are anti-inflammatory, so it is a very good thing to take. I went in for a fasting glucose blood test, and my fertility clinic had me down for the 1 hour wait. When I went to Life Labs, they kept asking, am I sure I'm not pregnant, as the 1 hour is for pregnant women. It's 2 hours if you're not pregnant. They sent me away. I confirmed with my doctor they wanted the 1 hour. In your opinion, which test is typically done 1 hour wait or two? Do you have an opinion on that one? So you can use either one. These days, because of COVID, we've actually stopped and we're just using your hemoglobin A1C and a fasting glucose. So you can test from that. And it's just as reasonable, and then there's no 1 hour exposure to 5,000 other potentially sick people that are running through the lab with you. So I would skip both of those and go straight to doing a fasting insulin and glucose level and get your hemoglobin A1C, and we can determine what's going on from that. Is 1,000 micrograms of folic acid too much during pregnancy?
That's perfect.
No, that's just 1 milligram, so that's perfectly fine. This has 5 times that, so it's totally fine, don't worry. Is it true that black cohosh can help to improve fertility in women with PCOS?
I don't use it in women with PCOS. Black cohosh supports estrogen, so we use it a lot for menopause, menopause patients, but I haven't used it in PCOS.
No, and in our review of the natural products that helped women with PCOS, it was not one of the ones that showed a benefit. So there is a fertility factor fiction on that from, when did we do that one? 2.5, 3 months ago?
Yeah, that's a while now.
Yeah, so go back on our YouTube channel, www.youtube.com/Dr. Victory, Dr. Victory. There is a factor fiction on natural supplements that are beneficial for women with PCOS, and my recollection is black cohosh was not helpful. Coenzyme Q10 is, inositol is, NAC is, so we use all 3 of those for sure. And actually the fish oils we were just talking about can help, but we don't use any of the other ones. So that is that. Should I have taken birth control before my first IVF cycle? My AFC is 19 to 21 each month, and it failed. Antagonist protocol use, 34 years old. Luteal Lupron protocol for IVF round 2. Is this best? Amy, I need to know more about why you failed. So there's not enough information there. It wouldn't be from the birth control pill, though, for sure. So we need way more details. Give us a call or reach out through Instagram. But there needs to be more info for me to be able to figure that one out. It would not be the birth control that made you fail. You want to take an IG one?
Yep. Hi, Dr. Victory. Can you take all of your vitamins at once, or do you recommend separating them?
I don't think there's a vitamin issue in taking them at once, but go ahead.
Are you referring to?
They're just saying vitamins. Yeah.
No, you can take them all. I
Yeah.
can see why not.
Yeah, there's no reason you can't take them all.
Cookie
at once.
Monster then. What is testosterone priming?
So testosterone priming is taking testosterone prior to your stimulation. And essentially the idea is that it is giving you the medium that is necessary to convert to estrogen and stimulate the eggs to grow. So you can convert testosterone into estrogen and vice versa in your body. So that's the idea behind testosterone priming.
Do you have any theories as to why some women are more susceptible to developing PCOS?
Well, we know some of the factors that contribute to it: family history of diabetes, insulin resistance, inflammation in your body, but no one actually knows what causes PCOS. From a naturopathic standpoint, is there a theory or?
No, I think there's a lot of factors that can be modified to help. But I don't know
what in terms of cause, yeah. So we frequently talk about different elements that can be addressed in terms of treatment, but in terms of causation, no one actually knows.
I'm taking the SA prenatal you have there, plus an extra 1,000 units vitamin D a day. My vitamin D sits at 95. Should I increase vitamin D dose?
So 95 is a good number, but we're just getting into cold and flu season and the winter. So your levels, if you were to stop it, your levels would probably go down.
But does she need to take more?
Oh, no, I would say keep doing what you're doing.
Yeah, I mean, I guess it would depend on when you took that level. If it was in the middle of summer when you were out in the sun a lot, and your vitamin D level might be higher because you do get it when you're exposed to the sun. So it depends on when it was taken, but that's a reasonable level. I wouldn't worry about that.
Do some over here.
Sure.
Yeah, that one.
Hubby was diagnosed with non-obstructive azoospermia, but found sperm via microtessi. Would you recommend freezing the eggs and injecting with fresh sperm, or freezing the sperm and injecting fresh eggs? Oh, great question. Total no-brainer. Definitely do not freeze your eggs. Cuts your chances in half. Sperm do fine when they're frozen, but eggs don't. So that's easy. Make sure you get fresh eggs and use frozen sperm. How long should we wait after sending in a referral to your clinic before we follow up? Usually we're seeing people within about a month or two. So if you haven't heard for an appointment time after about a month, you should follow up. I was diagnosed with PCOS pre-pregnancy. I'm now 29 weeks and I've passed my 2-hour glucose test twice now. Why twice? And my hemoglobin A1C was 5.1. Is this something that should be discussed with my RE? Nope, as I was on metformin while trying to conceive. Nope, you're good. Don't touch a thing, you're fine. What is a good AMH? Wow, we got Ashley K asking lots of questions. What is a good AMH? So it depends on which units you're using, but good is anything above 5 is reasonable in picomoles per liter, and high would be over 25. Good would be, 10, 12, 14, 15. Those are all good. Excellent is over 25. What should men take to increase sperm quality? Every antioxidant available: folic acid, zinc, coenzyme Q10, C, D, E, pretty much everything that's in all of these. We use ProFertile and we use Fertile Pro. Do these guys have a male specific?
They do. It's very similar.
Is it?
It's called male fertility.
Oh, okay.
Yeah, very easy.
So yeah, we use loads of different vitamins. ProFertile, which I'm sort of coming around to, is the only one with Health Canada approval because they actually did a clinical study which demonstrated conclusively that there wasn't an actual change in the sperm. So they're actually the only ones that have Health Canada approval for it. Not very many vitamin makers actually go for that. So I think that's worth considering. They are a little bit more expensive, but it does work. And they also have additional data that shows it reduces your sperm DNA fragmentation. So that's probably the way to go if you're really compromised. Let's do an IG.
Yeah.
Oh, Amy Devlin, do I consult with patients outside of Canada? I do. Jen can't because of her insurance, but I do, and I can always ask Jen questions and we won't tell anyone when I just
Are we frozen?
No. That's just lagging. Yeah. Does AMH levels ever increase over time?
Rarely. So most people's AMH levels will go down unless you are suppressed.
We're still good here.
Yeah. More IG.
Yep. What is the difference between multivitamins and prenatal vitamins?
So your prenatal vitamins are gonna have a little more calcium and folic acid, as opposed to just a regular multi. A lot of multis now though, they're focused on like age and gender, so you'll have like a multi for women, a multi for men. But the prenatals, those two are the main ones. And then each formula is gonna give it a different twist. So for example, Progestia focused a little more on the iodine for thyroid support. This one focused more on a lot of the antioxidants, like the chromium and zinc and a lot of the B vitamins. And then Pregbit separated the calcium and iron. So they all do something a little bit different.
Okay.
Is prenatal vitamins and fertility supplements the same? Is that the same question?
No,
That's different, right? Prenatal vitamins and fertility supplements the same.
Similar.
I usually recommend a prenatal for fertility because that's what we're aiming for. But with fertility, depending on what the concern is, then the supplements are gonna vary accordingly.
My husband has low testosterone. Is there anything he can take instead of testosterone injections to help boost his testosterone levels?
Yeah, you can't take testosterone injections or pills or gels if you're trying to get pregnant because it actually stops you from making sperm. So if you have low testosterone from a traditional medicine standpoint, you either need to address the cause, which can often be excessive weight gain, lack of movement, lack of exercise, that kind of thing, or you've got to take medications such as HCG or Clomid, and sometimes letrozole as well. All of those can help. Naturopathic, I don't.
Yeah, similar. So like the lifestyle thing. So like exercise. What was it? Like 150 minutes exercise a week showed a big increase in testosterone in men that were low. There are some herbal supplements that are helpful for increasing testosterone. Ashwagandha is one. And then just like cause. So obesity, smoker.
Yeah,
Like a lot of the
obesity,
lifestyle
smoking,
things,
that kind of thing is huge. Marijuana use reduces your testosterone. Alcohol shrinks your testicles. Stress. Yeah.
Would you easily see LUF with initial testing?
Would you usually see what?
LUF.
LUF. No clue what LUF is.
Please, doctor, I need the name of the prenatal vitamins on your table.
Okay, so this one's called Pregnant Folate. Here, Tarek, you want to show this?
Yeah.
So Pregnant Folate 5. I'll come up close here. I'm out off the screen.
We'll focus in on it.
You're out of focus there. Yeah, there you go. Yeah.
There we go.
So there's Pregnant Folate 5. Yeah. NFH. Progestia, Materna, and who doesn't love Costco? Kirkland brand.
6
You gotta refocus on us now. I can take a different question. We love Lisa. I love Lisa too. How do you know if you have bad eggs? Amy, that's a wonderful question, and the answer is you don't. So you can't actually tell egg quality until you've taken the egg out. However, your egg count is intimately related to your egg quality, in particular from a genetic standpoint. So if you have very few eggs, that suggests that the ovary is weaker, and when the ovary is weaker, the egg quality is diminished for sure. But there is no measure of egg quality short of getting it out and looking at the egg, which requires IVF.
So we got a clarification for the U.
LUF?
Yeah. Luteinized unruptured follicle syndrome.
So what was the original question?
Would you easily see LUF with initial testing? Luteinized unruptured follicle syndrome.
I've never heard of luteinized unruptured follicle syndrome. I'm assuming you're suggesting that your follicle is just not rupturing to allow the egg out. There are some theories about that, but most people refer to that as empty follicle syndrome, where we go to retrieve an egg and nothing comes out. Are you familiar with? Yeah. So it's pretty rare for someone to not be able to actually release their egg. And that can be tested by doing an egg retrieval. It's an awfully expensive test, but essentially that's IVF to see if that's, something that's going on. There would not be a test for that. There's no way to know if you're releasing an egg unless you actually get pregnant. That's actually the only true test of egg release.
Thank you. And yes. Yeah.
Another one there?
She said yes. That's what I
Okay.
guess. All right.
During the course of a pregnancy, do you do more blood work to test all levels? I know we did all the testing before, just wanted to know if it's checked during pregnancy. So we check your iron level, your ferritin level, at 28 weeks and your hemoglobin, but we don't check anything else once you're pregnant. The government here certainly doesn't pay for it. Do you recommend it to recheck?
No, unless there's a concern with something before.
Yeah.
Thyroid maybe.
Do I have any thoughts on why empty follicle syndrome can occur? So empty follicle syndrome is controversial. People don't even know if it actually is a real thing or not. So the idea is you go in to do an egg retrieval for IVF, you stick the needle in, you're draining all the follicles, nothing's coming out. The few times I've seen that happen is when the patient is very suppressed at the beginning of a cycle. So their LH level is very, very low. And then you try and use a Lupron trigger. That won't work. The other time that happens is if, for any reason, you back off their stimulation because they're overstimulating and their estrogen level crashes if you try and coast them, and then you try and get it to work, like bring it back, you can't get anything out of those patients. It's a disaster. So in those circumstances, if you have to back off the stim, which we don't really have to do anymore, because these days, even if your estrogen level is going through the use, we just use a Lupron trigger and you're fine. So in those cases, you can rescue those cycles. And in the case where their LH level is very, very low, you probably need to use some HCG in your trigger, or you have to measure their LH level after the Lupron trigger to make sure they're actually releasing. Most people believe that if you appropriately trigger the patient, you will get follicles. The other thing we've done is a double or a triple trigger, which is Lupron and HCG together, or Lupron and HCG, or Lupron and HCG. So there are some various options you can do. What is the best way to find a naturopath in my area who deals with infertility? Nick, if you're Canadian, the best way is to call and ask for Dr. Strong. In Ontario. If you are not in Ontario, what do you recommend?
So if you're in Canada, there is the website's CAND.ca, so Canadian Association of Naturopathic Doctors. And then you can, whoever is part of the association will be listed there, which is pretty much everyone. In the US, I don't know.
That's it, guys. We're at 9 o'clock. It was great being with you all. We look forward to having Jen back again. So thank you very much for joining us. Have a great night. If you didn't get your questions answered, make sure you show up next time. Send your questions in advance. We are always happy to address them. And we'll look forward to having you guys back again next week. Take care, and thank you again for watching. Make sure you like, comment, and subscribe on our YouTube channel. Have a great night, guys. Bye.